Over the weekend, an Indiana rabbi who works as a health resident chaplain shared his perspective through a series of tweets that have now gone viral.
Jenny Rudovich spoke with the rabbi who wrote about what doctors, nurses, patients, and their families are seeing in the ICU and what it's like to pray with people dying from COVID-19.
COVID is a cruel disease, and it's taken over our ICU.
The words are powerful.
So what is it like walking down the halls of the pods of the ICU? It's cold, it's dark, it's quiet.
A series of 20 tweets that went viral over the weekend.
Because these folks are all intubated, hooked up to massive amounts of equipment, machines breathing for them, and feeding them through tubes.
Sharing the grim reality of the COVID crisis inside Indiana hospitals. It's from the perspective of Rabbi Mike Harvey, a resident chaplain with IU Health.
One of the things I wanted to paint a picture of was the view inside that unit that often people aren't able to see.
Rabbi Mike says he witnesses fear from families and stress from overwhelmed staff who watch people die daily.
It affects us emotionally, it affects us mentally, it affects us physically. People are run down, they're getting sick. That in itself would be hard, but the fact that a few hours later, that room empties and then is replaced with someone else, we don't have a lot of time to process and mourn.
In those rooms, Rabbi Mike bridges science and faith, offering loved ones and colleagues comfort and prayer. Vulnerable moments that aren't easy, he says, especially with so many unvaccinated patients who didn't think COVID was real.
Sitting in my PPE gear, my N95 pinching my face shield fogging up, my gloves tight on my hands, and the unvaccinated wife, who made her husband refuse vaccination, asks me to pray for him as he lays dying.
The rabbi describes a losing battle right now in Hoosier hospitals, and he's begging people to get protected.
No one in the ICU expected to be there. Do what is recommended so that you don't, God forbid, end up under my care.